Okay, let's see. I am remote today, and yeah, we're gonna get with it. Let me take a look here. Everything's okay with the settings. Let's see. I haven't done it remotely a lot, so make sure we are okay here. So we're gonna go over. Perfect. I think we're okay. We're going to go over same journal, JAVMA, May 15, 2015. We're gonna be talking about the evaluation of a handheld device for measurement of beta-hydroxybutyrate concentration, identify prepartum dairy cattle at risk for developing postpartum hyperketonemia. And this comes out of University of Guelph in Ontario. Their goal was to evaluate the use of a handheld device for the measurement of beta-hydroxybutyrate concentration to identify prepartum dairy cattle at risk for developing hyperketonemia during the first week of parturition. So they looked at 210 dairy cows from 6 herds, collected blood samples from each cow 3 to 9 days before they expected to, before their calving date, and they measured the beta-hydroxybutyrate. They then compared those levels to laboratory measurements, and hyperketonemia was found if they had beta-hydroxybutyrate concentrations over at least 1.2 millimoles per liter or greater. So the results found that the handheld device was moderately correlated with that determined by the laboratory. Cows that had beta-hydroxybutyrate concentrations of 0.6 millimoles per liter or greater were 2.2 times as likely to develop hyperketonemia within 1 week after giving birth, with a prepartum versus those with a prepartum beta-hydroxybutyrate concentration of less than 0.6 millimoles per liter. And there was substantial agreement between beta-hydroxybutyrate and non-esterified fatty acids in the study. So let's talk about the foundation of this. So the transition period, 3 weeks prior to parturition to 3 weeks after parturition, is the greatest metabolic change for adult dairy cows. And dairy cows frequently undergo negative energy balance during the late stages of gestation, early stages of lactation, because their dry matter consumption decreases before giving birth and also decreases after giving birth. So they can't consume enough food to meet the energy requirements of lactation. They end up with a negative energy balance, and the body mobilizes fatty acids, some of which are metabolized into ketones. Ketone, for examples, are acetone, acetoacetate, and beta-hydroxybutyrate. And these are converted to ketones by the liver during negative energy balance. Dairy cattle normally have small concentrations of ketones in their blood during the earliest stages of lactation. A maladaptive response to negative energy balance can cause abnormally high concentrations of ketones, and that response would begin before parturition in some cows. Several methods for ketone detection are used. They use milk, urine, blood. The gold standard for detection of abnormally increased concentration of ketones, or called ketosis, remains the measurement of serum beta-hydroxybutyrate by standard laboratory measures. Cows with concentrations over 1 to 1.4 millimoles per liter during the early postpartum period have lower milk production and are at increased risk of ketosis, displaced abomasum, metritis, compared with similar cows who have concentrations of beta-hydroxybutyrate less than 1 millimole per liter. So another study found that the risk of clinical disease is greater for cows in which subclinical ketosis, meaning a beta-hydroxybutyrate concentration of 1.2 to 2.9 millimoles per liter, is diagnosed during the first week after parturition, compared with cows in which subclinical ketosis is diagnosed during the second week after parturition. So cows in which ketosis is diagnosed, again, those have measurements greater than 1.2 millimoles per liter. When they're diagnosed between 3 and 9 days after giving birth, they have a lower cure rate following treatment of ketosis. They treat with propylene glycol, And that's in comparison to cows diagnosed after 9 days after parturition. An abnormal increase in ketones in dairy cattle during the first week of after parturition may be an indication of metabolic problems during the late gestation period. And detection of those metabolic problems before giving birth may be beneficial to help managing them through this transition period. Cows with non-esterified fatty acids between 0.29 and 0.5 milliequivalents per liter during the week before giving birth are an increased risk of displaced abomasum, metritis, ketosis, lower milk production, compared with those that have fatty acids less than 0.29 milliequivalents per liter. It is inconvenient because blood samples should be collected only at certain times after feeding and must be chilled for analysis and only performed in a laboratory. So the current methods of measuring these are annoying. In another study, beta-hydroxybutyrate concentrations at 0.6 millimoles per liter or greater during the last 10 days of gestation had a lower milk yield on the first test day after parturition than the cows with a prepartum concentration of 0.6, less than 0.6 millimole per liter. Another study looking at 0.7 millimole per liter, those that had that level of beta-hydroxybutyrate or greater 1 week before giving birth were at an increased risk of being culled within 2 months after giving birth compared to those cows that had prepartum concentrations of less than 0.7 millimoles per liter, and cows with a concentration of 0.8 or greater 10 days after giving birth with increased risk of displaced abomasum within the first 2 months after giving birth. So the sensitivity and specificity of beta-hydroxybutyrate concentrations as determined by the handheld device to identify cows with subclinical ketosis is 88 and 96% respectively when you use a cutoff concentration of 1.2 millimole per liter. It goes up to 96% sensitivity and 97% specificity if you use a cutoff of 1.4. Then they go into the study to test this device. They found, as we said, the prepartum concentrations was moderately correlated with the prepartum laboratory concentrations. The difference between the mean prepartum device for concentrations of beta-hydroxybutyrate and the mean prepartum laboratory was very small, 0.004 millimoles per liter, so it's not significant. That's good. This device is accurate. Cows with a prepartum concentration of 0.6 millimoles per liter or higher were 2.2 times as likely to develop hyperketonemia within the first week of parturition compared to those who have less than 0.6. And then now the discussion. In another study measuring beta-hydroxybutyrate concentration is determined by the same handheld device. The study was highly correlated with that of the laboratory. However, in that study, a larger population of cows was evaluated and compared to this current study, and all blood samples were collected from cows during the immediate postpartum period with blood beta-hydroxybutyrate concentration expected to be higher than during the prepartum. They'll go on to say when a prepartum laboratory concentration of 0.8 millimoles per liter or greater was used as the gold standard for identifying cows that develop postpartum hyperketonemia, the device concentration of 0.7 or greater had a sensitivity of 93%, whereas if you use 0.8 as the cutoff, sensitivity went down to 79%, but the specificity at 0.7 was 83%, lower than if you use 0.8, which is 93%. So generally the cutoff used for identifying cows at risk for developing hyperketonemia within 1 week after parturition for the prepartum device can be interchanged with the laboratory one. Good news. For each laboratory concentration cutoff assessed, whether it's 0.6, 0.7, or 0.8 millimoles per liter, for identifying cows that developed hyperketonemia within 1 week after giving birth, the optimum cutoff for the device was sensitivity that ranged between 85 and 93%, and specificity between 76 and 87%. A novel finding in the study was that was the fact that cows with prepartum concentration of 0.6 or higher were 2.2 times likely to develop disease after giving birth. But maybe they need larger number of cows to further assess this. The substantial agreement between prepartum non-esterified fatty acids and prepartum beta-hydroxybutyrate for identifying cows that developed hyperketonemia after 1 week after giving birth was surprising because fatty acids and beta-hydroxybutyrate are from different biological processes. Results of the study suggest that determination of prepartum beta-hydroxybutyrate concentration by the use of handheld device is a convenient alternative to the laboratory. In the present study, prepartum device concentrations was moderately correlated with laboratory sensitivity specificity cutoffs at 0.6 millimoles per liter for identifying cows at risk of hyperketonemia during the first week of parturition is good, with similar values as the gold standard, which is laboratory. So they recommend a prepartum concentration of 0.7 millimoles per liter or higher based on this device to identify cows at risk for postpartum hyperketonemia. So pretty solid study. Obviously very, very useful and practical, which is great. So thanks everybody for watching. We'll be back tomorrow with another one. Talk to you then. Bye. Bye.